While we have been on air, the First Minister has been making a statement updating the Parliament on drugs policy. The country's drug death rate is the highest in Europe, having struck a record high of 1,264 deaths recorded last year, double the number that died in the previous year. Since Nicola Sturgeon took over as First Minister, in December, she replaced the Drugs Minister and promised to get more personally involved in tackling the problem. And she has now announced new measures at Holyrood. Our social affairs correspondent Chris Clements joins us now to tell us about them. Chris, we'll get on to what's been announced in just a second, but the Scottish Government's been under real pressure on this issue. This problem has been a long time in the making, though, hasn't it?
It's been decades in the making. It's for the last 6 years, Scotland's recorded its highest ever drug death totals, and actually, you mentioned the highest rate in Europe. There, it's actually 3.5 times the death rate of that of the rest of the UK. So you kind of get an idea how different and how badly Scotland is faring within the same legislative framework when it comes to dealing with problem drug use. Now, when the figures came out for 2018, a year and a half ago, there was this general shock about the fact that it had breached the 1,000 mark for the first time, and the then Public Health Minister, Joe Fitzpatrick, set up this drug death task force, whose job it was to really examine services across Scotland and see how they were working. And they identified a few problems in terms of choice and access to services. The number of people in services, it was only sitting at 40% of estimated problem drug users were in services. So that became a real issue. But when the figures came out in December, there was even more of a reaction, and that then led to Joe Fitzpatrick's resignation. And since then, as you've pointed out, the First Minister has stepped in. She's led the latest meeting of the Drug Death Task Force, and today she's announcing measures that will help those across this sector and those who are currently suffering from addiction.
Just run through for us then, Chris, the main measures that have been announced by the government today.
Well, first of all, she announced a package of £250 million over the next 5 financial years. Now, that's going to be used to expand residential rehab. 20 million a year of that will be used to expand residential rehab. She also said there will be an additional £5 million to be available until the end of March to expand the number of rehab beds in the area. But one of the bigger things that she's talking about is the expansion of medical assisted treatment standards. So really that is giving people a uniform experience of addiction services across the country. Now that includes things like same-day prescribing, that includes access to services on the same day that they approach them, because some of the information that we're getting from the Drug Death Task Force was showing that people's experience of it was varying across different parts of the country. One of the things that she said that they are still examining, and they haven't come to a final decision on it yet, is the introduction of a safer consumption facility. Now, these are places where people can go to inject drugs under supervision, and they can also have access to wraparound services as well. Now, she says that there are legal barriers to that. Obviously, we have said in the past that the Home Office, who control the Misuse of Drugs Act, they are against this type of proposal. So they're still looking at how they're going to get round the legal barriers to that. But she did say that another initiative that's been trialled in Glasgow already, heroin-assisted treatment, that is going to be expanded across different parts of Scotland.
And Chris, what's your sense of what the reaction to these announcements is going to be among those who work in this sector?
Well, sector-wise, I mean, there has been a huge campaign being led by groups like Favour UK, that's Faces and Voices of Recovery. They have been asking for this £20 million investment into residential rehab and to expand the number of places available. So I would imagine they would be particularly pleased with this. In terms of the other side of things, about the harm reduction model, in terms of the safer consumption facility, the fact that the government haven't committed to that yet may be disappointing to some, but there is still movement there. The activist Peter Criken, he's the chap who started his own consumption facility in the back of a van out with the legal framework. He has met with the First Minister, he's met with the new Drug Policy Minister, Angela Constance, and they do appear to be in discussions about this. And actually, he'd previously been charged with an offence under the Misuse of Drugs Act for allegedly obstructing a police search. Today, there's also been an announcement that those charges have been dropped as well. So you are seeing this slow crawl towards that. In terms of how people are reacting around the medical assisted treatment, we don't know yet. It's too early to say. But I guess over the course of the next few months, we'll begin to get an idea of how these services will change and how people are going to be able to interact with them.
Okay, Chris, thanks very much for that update. Well, joining me now is Austin Smith, who is Policy Officer at the Scottish Drugs Forum. Austin, thanks for being with us. Just let's get your initial reaction to what you've been hearing from the First Minister today.
Well, there'll be a huge welcome for this announcement, not only in terms of the detail that's been given today, and of course there will be more of that coming going forward, I'm sure. It's the tone of it. It's the notion that politicians are listening, that they actually have some insight and understand the nature of the problem and the breadth of the response that's required. So I would predict that there would be a broad welcome for this.
Which of the measures that have been announced do you think are going to be particularly effective? Talk us through exactly where this is going to make a difference.
Well, it's important to understand the context here. We're talking about the prevention of drug deaths, and what all the evidence says is the most important thing that the state can supply is good quality treatment, and that treatment has to be accessible and acceptable to the people who have a drug problem. And so it's not about which bit of it's most important, it's the fact that the spectrum of treatment would be in there and people would have the opportunity to engage in the treatment that they need. So the stuff around what are called the MAT standards, particularly around the accessibility and being able to get medication immediately or on the day you present, is absolutely crucial. And there'll be a huge welcome for that. There's a huge challenge in delivering that, as in much of this, but the fact there's a focus and a determination to do it is very welcome.
And the expansion of rehabilitation and rehab beds as well was something that the Scottish Government had been pressed on by opposition parties. Is that something that you think, in terms of what's been announced today, goes far enough in that area?
Well, I'm sure. I mean, actually, we don't know how much residential rehab costs across the whole budget. So in terms of the increase, it's hard to say, but it's a substantial investment. And so this will greatly increase the number of people who are able to access that crucial treatment. What I would say is that at present, the baseline, if you like, as the First Minister said, is 655 places were provided in the last year. Those figures for. So even if we double or treble that, it remains a small part of treatment. So to let you understand, presently there's very low uptake of treatment. We're only at 40% of people in treatment, whereas in England, for instance, that figure 60%. So to increase where we are to English figures, we need to find 12,500 treatment places today to catch up with the rest of the UK. So there's a huge challenge in that. And obviously the 655 residential places or people in residential services is a drop in the ocean, if you like, although it's obviously crucial to those individuals. It's small, and so scaling it up will be difficult. And even if it's scaled up greatly, it'll remain a smaller part. Most of the treatment will be done in the community under hopefully good quality services which meet the World Health Organization's recommended treatments.
Chris was mentioning there, ministers talking about examining the safer consumption facilities. There are difficulties around that, which he was outlining. Something like that, how much of a difference would that make? How big a factor is that in trying to bring these drug death numbers down?
Well, the drug consumption as proposed in Glasgow, which is the most developed plan for one in Scotland, is actually a reaction to two problems. One is street injecting, people injecting in public places, and the dangers associated with that for those individuals, and an HIV outbreak. And really, that's what those are evidence to respond to. In terms of deaths, the hope would be that people would be able to engage in other supports which might reduce their chance of death. So to impact on these figures, while it would be very important for those people in the city centre of Glasgow, to impact on these figures, we really need drug consumption rooms in any area of Scotland, in towns or cities most likely, where there is that problem of public injecting and a risk of bloodborne virus transmission.
Okay, thank you very much for your thoughts today, Austin. Thanks for being with us.
Thanks.
Well, time now.